Hi, Ms. Barry.
How's it going?
My name is Jamison. I'm going to be your physical therapist today. Have you ever been to physical therapy before?
I haven't.
You haven't? Okay. So I'm going to just give you a brief rundown of kind of what to expect with today. So today it's going to be about 30 to 45 minutes. We're going to really dive into what's going on. I'm going to ask you some questions at the front of this, get to know you better as a person because this is a working relationship. We're going to work together to help fix what's going on. And then after all those questions, we'll do some tests. I'll run some tests, get some information, get some numbers behind the things that I'm looking at, just so we can make some goals and a plan going forward to help you feeling better. Okay. Thank you for coming in and bringing this to us. We're going to do our very, very best to get you back to feeling normal. Do you have any questions for me before we start?
No, not yet.
Okay. All right. So first question, how old are you?
I am 58 years old.
58 years young, not old.
Yes,
58 years young.
Yes.
Yeah, okay.
Mom taught you well.
She did. She taught me a couple things, and that was one of the most important ones. What do you do for work?
So for work, I'm a adjunct professor at a community college.
Okay.
I teach English.
Oh, okay.
So be careful with your grammar.
Hey, I'll be as careful as I can be. My mom's an English teacher.
Correct.
My mom's an English teacher, third grade English teacher, so not quite the level you're at, but she's big into grammar, so.
Yeah, so I do that, and I also I instruct spin classes.
Awesome. That's really, really cool. Mm-hmm. Spin classes like the biking class?
Yeah, like the Gold Gym, like Pump It Up.
Okay, so you do that at Gold Gym? That's really cool. So how often do you teach? How often are you working as a professor?
As a professor, so 2 days a week I'm at the school.
Okay.
For 6 hours, kind of 6 hour days. We have like the long lectures.
Okay.
And then I'm in my office. I have to get the students' office hours.
Yeah.
And then but it's all because it's only part time. I'm an adjunct, so like the other 2 days I'm at home.
Okay.
Just like working on course material. Like
about how long are you doing that?
6 hours, probably. 6 hours.
So about 24 hours total per week.
Yeah.
Okay. And then how often are you instructing the spin classes?
I go 3 days a week.
Okay. Mm-hmm. Since your symptoms came on, have you been able to continue doing these things?
Not the way that I've been able to do them. Not the way that I usually.
I got you.
Yeah, I have to like limit myself to what I can do as far as like teaching. My pain starts to come on, and it just really affects like my work environment definitely. And I'm not able to to be as good as an instructor. Kind of like take it back some, dial it back.
Well, I'm sorry to hear that. We're gonna do our very best to get you back to doing those at the level you're doing ahead of time. So outside of work, what do you like to do for exercise? I know you teach spin, so I'm sure you love doing that by itself, but is there anything else you like to do for exercise and any other hobbies that you have?
What was that? One more time? Sorry. I got lost.
No, that's okay. So we talked about you teaching spin classes. Is there anything else that you like to do for exercise or any other hobbies that you have?
Besides the exercise, besides the spinning. Yeah. I like to go out and read poetry. Like I'm really
awesome.
I'm super deep with literature and stuff.
Yeah.
So I like to go out and read poetry.
That's really cool.
With my girls, we go to this little dive bar downtown.
Okay. Which one?
I think so. It's right next to that karaoke bar called Who Did It, or it's called Who's Who.
Okay.
And it's right next to that karaoke bar.
I'm a little familiar with that.
Yeah,
I think I know what you're talking about.
It's like a really no one knows the name of the place I go to.
Yeah.
And so if I told you, you probably wouldn't know. So.
Yeah, that's okay. I know the general location you're talking about. That's really cool though. Have you been able to keep doing that since your symptoms came on?
Yeah, I'm able to do it. I just can't be as expressive. With poetry, most people, they want to be so small and think it's just a few haikus, a few lines. Uh-huh. But no, you got to be big. You got to really show them what you're feeling. Otherwise, the crowd isn't going to feel it.
Yeah, I understand that. Well, we're going to do our very best to get you back to being able to make those big movements, be able to get you back to doing that at the full level that you want to. Mm-hmm. Okay, well. So now let's get into what's really going on. So where are you having pain? What brings you in today?
I've been having this pain right in the back of my neck.
Okay.
Kind of on my right side.
Okay, back of your neck there.
Yeah, it kind of comes over my head.
Okay, I'm gonna just stand up and look behind you, just so you can kind of see what you're talking about. Do you mind showing me that again there?
Kind of like this pain, right in the back of my neck.
Okay. Mm-hmm. And is it just there on that right side?
Yeah, so I get pain. Yeah, it's only right here on the right side, but then I end up with getting this big headache from it. I get this huge big headache. Yeah, for sure.
Okay. Where's that headache occur? Is it in that same area back there, or is it somewhere else?
Yeah. It just kind of runs up from my neck.
Okay.
And then also it's gonna sound weird. It's gonna sound real weird.
Okay.
I feel like I got pain kind of like a lot of pressure or tension right behind my eye.
Really?
Yeah.
Right eye, left eye?
My right eye.
Your right eye?
That same region.
Same region. Okay. Well, we're going to take a look into that. We're going to see what's going on with that. That's not totally out of the ordinary with headaches like that. So I don't want you to be concerned that it's something absolutely crazy or extreme. But I'm going to definitely ask you some more questions about that.
Okay.
So how would you describe the neck pain and the back of the head pain you're having there?
Okay, so like the neck pain is like it's there all the time. It's pretty dull though, like an ache. Like
Okay.
It's like pretty like dull ache.
Okay.
And then the back pain, it's like, the headache pain, it's like sharp.
Okay.
It's like on and off, on and off.
On and off as in like an intermittent type thing. It's not always there.
Yeah, intermittent.
Okay.
Yeah, I don't want to use too big of a word. You're pretty young, so I don't want.
I am pretty young. English wasn't my major either, so some of those big words get me.
I can kind of tell.
That's okay. So one of the scales that we use here to rate pain, just put on a numerical scale, is 0 to 10 scale. 0 being no pain at all, and 10 being the worst pain you've ever imagined. We got to take you to the hospital. So for that neck and head pain specifically, how would you rate your pain right now?
So the neck pain, I would rate right now I'd give it a 2.
Okay.
And then like up into the head, like that's going to be more of like a 1.
Okay. Whatever those are at their absolute worst, how would you rate the two of them?
For the neck, I'd give it a 7. It gets bad.
Okay.
My neck gets bad. And then for the headache, 5. I mean,
a 5?
It's not as bad, but it's still pretty bad. But yeah, so I get a 5.
And then whenever it's at its best, you're having the least amount of pain that you can have.
My neck can get down to like a 1.
Okay.
And then at its best, like I don't have a headache.
Okay. All right. Do you have any numbness and tingling?
I don't.
You don't?
No.
Okay. So you've got those two separate things going on there. Do you tend to see a relationship between the two of those?
I will say that when my neck pain is like bad, that's when my headache comes on.
Okay.
It's worse.
So the neck pain is the neck pain always first then?
Yes.
Neck pain's always first.
Yes.
Okay.
Yes.
And then the pain that you're having around the eye comes on after that.
Yeah, it kind of like goes along with my eye, like not my eye, my headache. It kind of like goes along with my headache, and it comes on.
Okay. So what things tend to make your pain worse? Tend to get up higher to that 7 out of 10 on the scale?
So we're on a bike, right? We're going, we're cycling, and then I have to like look up and like make sure everybody's doing their stuff, everybody's form's right.
Okay.
And man, when I tell you, like that really kicks my butt.
So whenever you're, just to make sure that I'm seeing this the right way, you're kind of hunched forward on the bike?
Yeah, because you're on a cycle, like the seats are like this, and you're riding it like this, and you're kind of going, and you're biking, and you're looking up.
Back.
Yeah.
Okay. And about how long does it take for that pain to come on?
Man, it's kind of like with that pain, like it could be one. I would give it like one session before my head's killing me, and my neck's killing me.
Okay.
So
and how long is the session?
An hour.
Okay. So we got that one. About how long does it take for that pain to go away after you're done?
I don't know. I haven't really been keeping track of that. I don't know. I try to like stop thinking about it, but.
Okay. Maybe next time after you have that pain class you're teaching, just kind of maybe look at the clock, see when it is, and whenever it goes away, look at it again. Just because that will be a good number to have to try to track and look at. Is there anything else that tends to make your pain worse?
Just like in certain positions, like if I keep doing like certain positions.
Okay. What positions?
Anything that involves like my head like being back like this.
Okay.
That like really gets me. So if I'm like looking up at something, or if like lecture, like we teach this big like professor hall.
Okay, yeah.
So like it goes up, and so when I'm there and I'm like looking up at all the students around, making sure all the students pay attention and not
not on their phones, texting things.
Days,
they
right?
do. They're crazy.
Audacity.
They do.
But yeah. So when I'm doing that and making sure everybody's paying attention, if I'm like looking too long, I get this crazy neck pain.
Okay.
Yeah.
So about how long after like repeating that position does it take
5
to
minutes.
get worse? About 5 minutes?
Yeah.
Okay. About how long does it take to go away?
That's one of those other things I just haven't like really paid attention to.
Yeah.
I guess I should pay attention more to myself.
No, that's okay. But good thing is room to grow there. We can definitely start. I can have you can start looking into that, and then next time you're in here, we can discuss those things as well.
Yeah.
Okay. That's some great information there. Thank you for sharing that with me. So what things tend to make your pain get better? What things make it better?
Lying down, like looking down, or like lying on my side, that helps.
Okay. Is there a specific side that makes it feel better, or just either side?
I mean, either side works. I guess it depends on. So when I lie down on my right side, it kind of like stretches out this right side, and it makes it feel better. And that's the side that really like bothers me, especially like massaging and putting pressure on my neck.
Gotcha.
It helps a lot.
Okay. So you said pressure massage to that right side there. About how long of doing these things does it take to make your pain feel better?
It just progressively gets better, like over like time. So like maybe like up to 20 minutes. I can do
Okay.
something like one of these, but it starts out immediately. It's relieved, but then it just gets better and better as I'm on this hours on the side.
Okay, good deal. And then for the eye pain that you're having, so whenever you the neck pain gets worse, the eye pain comes on. What do you do to make that eye pain?
I do the same things.
Same things.
Yeah, same thing. It kind of helps. Like I said, like I feel like when this pain is being managed, I don't even notice that pain.
Gotcha. Okay.
I don't even notice it.
Okay. All right. Well, that's good. Nothing. You don't do anything different for the eye pain. Just the exact same things.
No, I don't. No, not really. I mean, I take medication every now and then. I'll pop some ibuprofen.
Okay.
But
okay. I'll ask you a few more questions about the ibuprofen later on. Once we get a few more questions in. So when you get up in the morning, how does your head pain feel?
It's better.
It's better?
Mm-hmm.
Okay, good. Okay. And then throughout the day, as you're after school teaching your spin classes and everything, how does the pain change?
Worse, like after like work, especially with those students, man. Like I don't know. I don't know if it's like my neck is causing my pain or if it's them. But
just the sheer amount of students in there.
Jeez, you think?
Lots of kids. It's hard to teach them English too. English is a tough class.
They pay so much money for this other education and they just not value it. You know?
Yeah.
I don't like it's
a hard thing to teach.
It's something your generation started.
Well, you know, some of us, it happens in every generation, but I can definitely agree it's going on in our generation.
Yeah,
it makes you feel any better. I value my education.
There we go. Yeah.
And I'm glad to be in a position to help people like you.
I applaud that. I appreciate that.
Well, thank you, and I appreciate you saying that. Does it tend to be worse if you're coming off of teaching, or worse whenever you come off of the exercise classes?
I'd say exercise.
Okay.
Exercise more. I mean, it's just more intense.
Gotcha. Okay. So on those days that you're not teaching, because I know you teach the spin classes 3 days a week, does it tend to be not as worse at the end of the day if you're just teaching the English classes?
Yeah.
Okay. And then at night, when you get home, done with the spin classes, done with the day, how is your pain at that point?
I mean, I get a headache at night.
A headache at night. So that's whenever the eye pain comes on specifically?
Mm-hmm.
Okay. And then for the eye pain, how's that in the morning?
Sorry.
That's okay.
I'm a little sleepy here.
It's okay. It's the middle of the day.
And what was that last question? I'm sorry, I lost again.
Oh, that's okay. The pain that you're having behind your eye. How is that in the morning?
I mean, it's okay. Like I don't notice it in the morning.
Okay.
Just at night.
Okay. And throughout the day, it's not there either. Just mainly at night.
Yeah, just mainly at night.
Okay. All right. So we're gonna go through that form that we had you fill out whenever you first came in. Thank you for taking the time to fill that out.
Oh, my pleasure.
That's really important for us to just go through and cover some of those things.
My pleasure.
During this, and it really saves us some time by having you do that early. So I appreciate that. So I noticed that you're diagnosed with ADD. Does that tend to interfere with anything that you're doing throughout the day, with work, with the spin classes, or anything like that?
I get distracted sometimes.
Get distracted
sometimes. Very easily.
Okay. Does it tend to interfere with any of the activities that you do throughout the day, besides you just getting distracted occasionally?
No, usually if I'm teaching sometimes, like if a student does something and I'm lecturing and I see some kid on her phone texting, I definitely get distracted.
Yeah. Okay.
But other than that,
it would distract me too as a professor. And I don't have ADD.
Those freaking kids, man.
They're crazy sometimes. Okay, well, as far as that's the only thing that we really need to talk about. Next question: did you have any imaging done on the neck and the eye and everything like that?
One more time. I'm sorry. ADD kicking in.
Yeah, I said imaging. Imaging was a poor word choice there. Did you have any X-rays or MRI or anything done on your neck?
Oh yeah. I had an X-ray done 4 days ago.
Okay. Do you know what they said about it?
I came back negative.
Okay.
I don't know what negative means. But
okay. So that means that they're based off the pictures that they saw, there wasn't anything wrong as far as the pictures.
Okay.
It doesn't mean that the pain you're having is any less real than it is. It just means that there isn't anything structurally wrong per se.
Okay. Yeah.
And so we talked a little bit about you getting distracted sometimes.
Mm-hmm.
So I guess that would. Do you have any other barriers to learning besides that?
Probably that's probably my biggest one. If I'm not interested in it, if it's not catching my eye,
okay,
and I see something more interesting, like with exercises too.
Yeah.
So like with those, you better keep it fun because if not, I'm gonna try to do what they do out there.
Yeah, I will make sure to do my best to keep things fun while also helping you get better.
Yeah.
And thank you for telling me about this ahead of time. If you get distracted, that's okay. Just ask me to repeat the question. That's not a problem at all. I don't mind doing that. I've had the time to do that. No, it's totally fine. but I just don't want to miss something important that you're telling me just because like you didn't hear my question or anything like that. So I want to make sure that I'm able to help you as much as I can. So if you didn't hear me ask a question or hear me say something, just feel free to ask me to say it again. It doesn't bother me at all. So medication, we talked a little bit about the ibuprofen you were taking earlier. About how much of that are you taking?
Taking 600 milligrams.
Okay.
PRN, you know what PRN means?
Yeah, just as needed.
There you go.
As needed.
Mm-hmm.
I know a couple of those acronyms. Okay, so is that maybe like once a day, twice a day? Do you know about how often?
PRN, so as needed.
Okay.
So usually, I mean, it depends on what I do. It all depends on the day.
On that.
Yeah. If I'm doing a lot of exercise, if I'm doing a class, I'm probably going to be more likely to take it.
Gotcha.
Than me just sitting at home.
Okay. All right. And so, what do you think? What started this pain for you?
Whew. Let me take it back there.
Tired.
Yeah.
Sleepy.
So yeah, and just that. I mean, that's kind of rough for me, but talking about my pain. But patients, my neck started hurting. It's been hurting on and off for a while.
Okay.
But the neck, I mean, the headache is like something new.
Okay.
I spent a lot of time looking up at stars and stuff. Like, I really love the meteor showers.
Yeah, that's awesome.
So 3 weeks ago, there was like a meteor shower.
Yeah, I remember seeing something about that. I wasn't out there watching it, but I remember seeing something about that.
So I was like looking up at the sky and stuff, and I'm not able to say like any like thing like I did specifically that night that like caused my neck pain, but I definitely my neck started like around that time, and then it just got worse over time, and then the headache started coming on.
Gotcha, but it all started around that night 3 weeks ago.
Yeah, well, not the headache. The headache is something new.
But the neck pain.
Mm-hmm.
Okay. Before this time 3 weeks ago, whenever it started, have you ever had neck pain or headaches before this?
No, not really.
No?
No, like I said, I'm pretty healthy. It's nothing.
Okay. All right, good deal. So at the end of this, like I said, we're going to go through all the tests and measures and everything after this, but I'm going to send you home with what's called a home exercise plan. That's going to be some things to supplement what we're doing in here just to help you recover faster and just continue to move towards your goals. I'll give that to you on a piece of paper, but is there any way that I can present it to you specifically that would help you remember it or learn it better?
Yeah, just show me, have me do it, and then that's going to be the best way.
Okay, perfect. We can do that. Okay, so what are some of your goals that you want to get out of physical therapy?
I want to get my neck moving normal again. Like, I just want to be able to do everything that I can do. I want this headache to go away.
Yeah, understandable.
I want to be able to do I want to be able to do a full class without like any pain, anything, and then at the least in 3 weeks, I want to get back to my get back to my poetry.
Okay, well I think
I have this big poetry thing I got to get back to.
Perfect. We're going to do our very best to get you back to that. I think these are some great goals. These are things that we can definitely work towards. Your goals are my goals. What you want to get out of physical therapy is what I want you to get out of physical therapy. I'm here to help you get back to what you're wanting to do. The full goal of physical therapy, just as a profession, is getting people back to doing what they're wanting to do. And so we're going to do our very best to create some exercises and some different movements that are going to help you get back to do that.
Yes, sir.
And then I also see that you filled out what's called the Neck Disability Index for us. Thank you for doing that. That's something that we're going to use to help create those goals. Well, like as you saw, it had a bunch of different questions involving different motions of the neck and everything. Mm-hmm. So we're going to be using that a lot in our creation of goals as well. Mm-hmm. Do you have any questions for me at this time?
No, sir. No, not at all.
Okay. So the next thing we're going to be moving to is the objective portion of our exam, where we're just going to be doing some tests and measures and everything. So it's going to involve you laying down, standing up, a couple things. I'm going to do my very best to make sure you're not having to get up and down a ton. But first thing is, sitting here right now, what would you rate your pain at on that scale of 0 to 10?
2 out of 10.
2 out of 10, okay. Next thing I'm going to do is I'm just going to observe your posture while you're sitting here. So sit how you would normally sit, if your desk's working on work or whatever, and I'm just going to look at it from a couple different angles here. All right. Let me just make a few notes. I'm going to be writing some stuff down during this.
Okay, that's fine. Make sure you have it.
Okay. All right. Next thing I'm going to do is check how your shoulders move. So if you don't mind raising your left shoulder above your head. Is there any pain with that?
Yes, sir.
I'm going to apply a little bit of pressure here. Let me know if there's any pain. Any pain?
No, sir.
Okay. I'm going to have you almost chicken wing your arm out to the side here like that. And same thing, I'm going to apply some pressure down.
Okay.
Any pain with that?
No, sir.
And I'm going to be bringing the arm back behind you. Okay. Any pain with that?
Yes, sir.
And the reason we're checking the shoulders here is because the shoulders are connected to the bones and the muscles of the neck. There's some muscles that run from your head back here, very close to where you're having that pain, down into your shoulder.
Okay.
I just want to make sure that it's not anything going on the shoulder. We're going to do the exact same thing with your right arm over here, so go ahead and raise that above your head. Okay. Any pain with that?
No, sir.
Okay. I'm going to have you wing that arm out there. Any pain with that?
No, sir.
And then back behind you. Okay. Any pain with that?
No, sir.
Okay. All right. Next thing I'm going to have you do is slump forward and bring the shoulders forward. We're going to be looking at the portion of your spine that is right through here.
Okay.
Same thing as I talked about the shoulders. There's some muscles back there that go all the way up to your neck as well. I just want to make sure that it's not something happening down there causing your pain.
Okay.
Okay, so I'm going to have you come forward a little bit. I'm going to apply some pressure through your shoulders. Okay. And stay just right there for me. Any pain there with that?
No, sir.
Okay. I'm going to have you lean back, just kind of roll the shoulders back as much as you can. I'm going to apply a little bit of pressure going back that way. Any pain with that?
No, sir.
Okay. Just going to make a few more notes here. All right. And now I'm going to just measure some of the motions of your neck.
Okay.
These give me some good numbers to look at moving forward. And we can check and reassess these throughout as we're going through treatment. So the first one I'm going to have you do, I'm just going to make sure you can move in all these directions first without pain. So I'm going to have you bring your head forward and look towards the ground.
Okay.
Any pain with that?
Oh, no, sir.
Okay. I'm going to have you look back up to the sky. I know this will cause a little bit of pain, so just go as far as you can without pain.
Right there.
Okay, go ahead and come back down out of that pain. I'm going to have you look to your left, so just rotate to the left. Okay, any pain?
No, sir.
All right, and now to the right. Any pain with that?
That one, yeah.
It causes pain? Okay, go ahead and come back to the middle there. And then we're going to do what's called side bending, so just try to touch your ear to your shoulder while leaving the shoulder there. Okay, to the left, and then back to the right. Any pain with either of those?
Just a little pain going to the right.
A little bit of pain going to the right. Okay. Now I'm going to measure all three of those there.
Okay.
Okay? So we're going to do the head down towards the ground first, so we get some things set up here. Okay? And go down towards the ground. Okay? All right, you can come back up to normal there. And then going back on towards the sky just as far as you can without pain. Okay, go and come back. I know that caused some pain there. All right. I'm going to come back behind you for these next few.
Okay.
That's where we got our best measurements from. All right. And I'm going to have you go down to your left. Try and touch your shoulder to your ear there. Okay. And back up to the center. And then down to the right. Okay. And then back up to the center. And for this one, I'm going to have to come up over the top of your head. All right. And then I'm going to have you turn your nose to the left and rotate to the left just as far as you can. Okay. And then back to the center. And then to the right.
Yeah, right there.
Okay. Back to the center. All right. So I could do this passively movement for you, but since you're having so much pain with it, I'm not going to do that to you.
Yeah, okay.
There's no need right now for that. Okay. I'm just going to make a few notes of the numbers I got there. Okay. All right. So the next thing I'm going to do here is called a neuroscreen.
Okay.
This is just to rule out any nerve involvement that's going on with this as well.
Okay.
So for this one, do you mind? It's going to involve me touching various parts of your shoulders and everything. It'd be easier if you had your shirt off for me.
Okay. Mind if I just stay in my sports bra? I don't want to take
That's
that
okay.
off.
Yeah. No, that's totally fine.
They don't look the way they used to.
Well, that wouldn't be totally appropriate if I asked you to take that off.
They don't have any lady therapists in y'all's clinic. Why they got you doing it?
Do what? They have me doing it?
Why do they have you doing it?
If you feel more comfortable having a lady facilitator.
No, it's not a thing. I was just wondering.
No, they do. I was the person just assigned specifically to your case today.
Okay.
I have the pleasure of working with you and getting to know you today. But if you would feel more comfortable having a lady physical therapist do this, that is totally fine. You just gotta let me know.
Okay. You
Okay.
got it. No, you're good.
Okay. If you don't mind scooting back just a little bit for me, I'll lower this table down for you. That way your feet can be on the ground. I just gotta be able to get in front of you here. So the first portion of this test, do you mind raising your
Yeah, for sure.
up just a little bit? It's going to involve me feeling both sides of your upper body, and it should feel something like this. And just let me know if you feel a difference between the two.
Okay.
It's going to involve me touching your face as well.
Your hands are cold.
My hands are cold?
Yeah.
I'm sorry about that. I'll try to warm up a little bit here.
Okay.
It'll involve me touching your face as well, down to your thumbs.
Okay.
And I'll let you know whenever I'm done. Do you mind closing your eyes for this?
No.
Okay. Does this feel like this?
Yeah, it does.
Does this feel like this?
Yeah.
Does this feel like this?
Mm-hmm.
Does this feel like this?
Mm-hmm.
Does this feel like this? If you don't mind opening your hands up for me.
Oh, sorry.
That's okay. Does this feel like this?
Yes, sir.
Does this feel like this?
Yes, sir.
Does this feel like this?
Yes, sir.
Does this feel like this?
It does.
Okay, you can go and open your eyes for me. Next we're going to be doing is going to be, I'm just going to test the strength of the nerves to your muscles. So for the first one here, I'm going to have you tilt your head down and don't let me press it back up. Okay, ready? Ready?
Mm-hmm.
Hold, hold, hold. Okay. Now I'm going to have you just look straight forward, and I'm going to place my hands here, and don't let me turn your head to the left or right, okay?
Okay.
So don't let me turn it to the left. Don't let me turn it to the right. We're going to do side bending now. So don't let me press your ear down towards your shoulder. Ready?
Okay.
Hold, hold, hold. Ready? Hold, hold, hold. Okay. Next I'm going to have you bring your shoulders up towards your ears. Don't let me press them down. Ready? Hold, hold, hold. That spin class is giving you some strong shoulders.
Yeah.
Next I'm going to have you bring your elbows out. Don't let me press your elbows back down towards your body. Ready? Hold, hold, hold. I'm going to have you bend your arms together, like a bicep curl there. Don't let me pull your arms out. Ready? Hold, hold, hold. Ready? Hold, hold, hold. And don't let me push your wrist in. Okay, ready? Hold, hold, hold. Same thing over here.
I got pretty big hands for a girl, I know.
Hold, hold. Yeah, well, you're in great shape. Okay, don't let me pull your arms out, okay? Ready? Hold, hold, hold. Same thing. Ready? Hold, hold, hold. And then go ahead and bring your fists out and don't let me push them in. Ready? Hold, hold, hold. Ready? Hold, hold, hold. Okay, I'm going to have you make 2 thumbs up here. And don't let me pull your wrist out. Ready? Hold, hold, hold. Ready? Hold, hold, hold. Okay, I'm going to have you make 2 thumbs up here. I'm an Aggie, so I love this position. And don't let me pull your thumb down, okay? Hold.
You said you're an Aggie?
Hold. I am.
You know, you Aggies tend to think you're better than everyone.
Hold.
Naturally, the ones I've met.
Hold. Aggies is just as a whole. Sometimes we get that stigma. I don't know that I fully believe that. I think there's lots of great schools out there. I'm a little biased though. I love College Station.
Okay.
Love my university, but I'm sorry that you get that persona from us.
Mm-hmm.
Next, I'm going to have you curl your hands here and don't let me pull your fingers out. Ready? Hold, hold, hold. Ready? Hold, hold, hold. I'm going to have you flip your hands over and keep your fingers together. I'm going to try to pull them apart. Hold, hold, hold. Hold, hold, hold. Now you can spread your fingers apart and don't let me press them together. Hold, hold, hold. Hold, hold, hold. Okay. All right. And now for this last one, I'm just going to be testing the reflexes here with this little hammer. It's going to involve me hitting my thumb for the first one, so you just go ahead and relax and let me do it here, okay?
Okay.
Ready? And then can I have you put your hand on your knee right here, and up like that? Okay. We're going to do the exact same thing on this side. And same thing, putting your arm up there like that. Okay, good deal. We got some good information there from that. All right, just a few more tests, then we'll get you out of here.
I get to my TV shows.
Get to your TV shows. What do you watch on TV?
Well, you know, you probably don't know about this. General Hospital, it's been this before your
I know
time.
what General Hospital is. I'm more into Grey's Anatomy myself.
That's what young kids watch.
Yeah, my wife and I watch that.
That Marriage of Grey. You know.
She's a
good one though.
My wife's a nurse, so she really enjoys that. So, first test we're going to do here is I'm going to have you just sit there. I'm going to apply a little bit of pressure through your head. Okay? Let me know if you have any pain with this. And how are you feeling there with that?
I feel okay. It is a little painful.
A little painful?
Mm-hmm.
Okay. All right.
Oop. Okay there?
Yeah, just need to make sure not trip over these cords here.
Mm-hmm.
All right. I'm going to go ahead and have you lay down for me on your back.
Okay.
And for this next test, I'm going to put you into the position I want you to be in, and then following me doing, I'll put your head back down. I'm going to have you go into that position and hold it for as long as you can, okay? So what we're going to do is we're going to tuck the chin in. Is it okay if I touch your head? We're going to tuck the chin in and raise your head up off the table to about there and hold that, okay? So whenever you're ready, go ahead and get in that position. I'm just going to time it, and we'll see how that goes, okay? Ready? Go. Just hold it for as long as you can. Okay. At the end there, did you have any pain or anything?
I just got tired.
Just got tired?
Hard, yeah.
It's a hard test. It's deceptively difficult. Okay. Now for this next part, I'm just going to feel around on your neck and your back. So you just go and relax. So you just kind of let me know what you're feeling as I'm doing that, okay?
Okay.
All right. So I'm going to have you shift just a little bit towards me. I'm gonna hold your head up, and I'm just going to be feeling the muscles and the bones and the joints in the back of your neck here. I'm feeling what's called the vertebral joints, the Z joints in your neck that just go between all the vertebrae in your spine right now. Do you have any pain or anything with this right now?
It's so like that right side of my neck, a little bit.
On the right side over here? Up higher here or a little bit lower?
Kind of like a little bit higher.
A little bit higher? Okay. All right. Thank you for telling me that. How about on the left over here? Anything over there on the left?
Not so much. That's fine.
Okay. All right. So I'm going to just feel the musculature of your back here now. Up through here and then on the front of your neck. And just let me know if you have any pain or anything with any of this. Let me do my best to not cause you too much pain.
Okay.
Okay? All right. Do you mind flipping over onto your stomach for me?
Give me some time, though, sweetheart. I don't move the way I used to.
That's okay. Take all the time you need. All right. So I think I'm just going to feel back through here as well. Do you have any pain up there? I know that you have some pain over here on the right up in that region. Do you have any pain down in the muscles of your back down here?
No, not really.
Not there? Okay. I'm just going to feel a little bit further down. Okay. So since you're having some pain over here on that right upper side of your neck, I'm going to do just a short little treatment on that there. Is it okay if I go ahead and do that?
Sure.
Okay. I'm going to raise it just a little bit. It's going to involve me standing. Let's take a little bit of a better position there to really help you feel better. Okay. All right, I'm going to lower your shirt down just a little bit to do that. Go and relax your neck as much as you can for me. Okay? So I'm just going to do this here for about 30 seconds. And we'll do this for 3 rounds. I'll give your head just a little bit of a break there. We'll do 2 more rounds of that. Figured I'd just do this here while you're laying down, that way I don't have to make you lay back down again. We're going to do a few more, I'm going to look at a few more things as you stand up, but I didn't want to make you have to get back up and down in time.
Okay, thank you.
You're welcome. Though you're in pain, I want to limit the amount of times I'm making you move your head around like that. Okay? We're going to do 1 more round of that. Okay, I'm going to have you sit up on the edge of the bed here. Take all the time you need. I'm just going to sit up like that. Feel okay there?
Mm-hmm.
Okay, let me go and lower the bed down just a little bit more.
You mind handing me that paper that I brought in?
Yes, I can do that. We can just a second.
Yes, sir.
All right.
You know, we got to keep our paper on us for old people.
Yes. Okay. I'm going to go ahead and have you stand up real quick for me. We're we're just going to do a few more things.
Okay.
So go ahead and just stand up for me. There again, I'm going to just observe your posture while you're standing.
Okay.
I know I did that treatment on you, so maybe a little bit different now. But just go ahead and get one more look. Then we'll make you stand up again.
Okay.
I didn't have to. All right, and then one more thing. If you can just walk to the wall and then back for me.
Right here.
Yeah, and then just turn around and walk back towards me.
Okay.
Okay, I'm going to just have you wait here for a second. I'm going to have you do that one more time. I'm just going to look at it from a different angle.
Okay. Want to go now? Or?
Yeah, go ahead.
Okay.
You're good to go. Okay. All right. One last little thing before I have you sit back down. Can you show me movement that reproduces your pain?
Yeah. This is gonna be weird. One of the exercises I do though, but usually if I'm like this,
when
I'm looking up.
Yeah.
Sheesh. My pain just goes up.
Causes some pain
Yeah.
there. Okay. All right. So, is it still causing you quite a bit of pain doing that?
I mean, not as much. If you did those things, like those moves, not as much as it usually would.
Okay, good. So the mobilization I did on your neck, do you think that helped?
Whatever you're pushing on the back of my neck there, that helped out a lot.
Okay, good deal. Okay, I'm going to have you take a seat here. We'll just kind of explain some of the things going on.
Okay.
So what I think is going on here is the musculature in the back of your neck is pretty tight. The joint as well is not moving super well. So I think that's just got a lot to do with the muscles going back there.
Okay.
Maybe some of the way that you're sitting and your posture as well. So I think that's a lot of what's going on is the musculature there with the neck. So we're going to be doing some of those mobilizations here in the clinic that I really think are going to help. And another thing that I want you to do at home, I'm going to teach you real quick, this is the first thing I'm going to have you do whenever you go home, is that they're just chin tucks. And so tucking the chin back like that. Very similar to what we were doing laying down. But we're going to just do it in the seated position. So I want you to do for the next couple of days until I see you next time, we're going to do 3 sets of 10 of these. Okay? What you'll take is you'll put your 2 fingers right around your chin, and you'll press back and really just straighten yourself up there like that. Then relax forward. And press back and go forward. And we're going to do that 10 times, take a little break, and we'll do that for 3 times.
Okay.
Does that sound okay?
It does.
Okay. Good news is this, is with therapy and everything, we're going to get you back to feeling great. Very shortly. Maybe 6 weeks, you should be feeling good. I know you have that poetry reading in 3 weeks. I'm hoping to get you to feeling at least somewhat better, if not fully better, by 3 weeks. So you get to do as much of that as possible. Do you have any questions for me at this time?
No, that's going to be all. You think I'll be ready in 3 weeks for that?
I think you may not be fully better at that point, but we're going to do our very best to get you feeling as good as you can at that point.
Okay. No, that's all I got, Doc.
Okay. Thank you so much for coming in. I really appreciate your time.
Thank you. I want to take the time, just thank you for helping me out today. I mean,
you're welcome.
Coming in, I'm always worried, with younger people, there, because I know you're just starting.
That's understandable.
So
you see those young people every day in class, like you said, they're on their phone all the time. So I understand the hesitation with it, but
you, young man, you did a great job today. And so
thank
I want you to know that your mother would be proud.
Well, thank you. I appreciate that. I'm going to take you up to my receptionist up front. Her name's Beth, and she's going to get you scheduled out just for some times. I think we're going to shoot for 2 times per week right now.
Okay, thank you.
All right, thank you so much. Have a great day.